Okay, so today we're diving into a procedure that's really at the crossroads of medicine, law, and, some of our biggest questions about life and death itself. We're talking about the autopsy. Let's jump right into this fascinating and honestly often misunderstood final investigation.
So how do we learn the truth from death? It's a question humanity has been asking for, well, millennia. This whole quest, whether it's driven by suspicion after a crime, pure scientific curiosity, or just a family's need for closure, it led to the development of a pretty profound science. But what does it really mean to find the truth after someone's gone?
Well, the answer to that is kind of hidden in plain sight. It's right there in the name of the procedure. The word itself tells you everything you need to know about the core principle here: seeing for oneself.
The word autopsy actually comes from the ancient Greek autopsia, and it literally means to see for oneself. And that's the whole point, right? This isn't about guessing or speculating. It's a methodical, hands-on surgical process. It's designed to replace all that uncertainty with clear, verifiable facts.
So why is this act of seeing for oneself so absolutely crucial? Because the answers it uncovers can literally solve crimes. They can prevent future medical mistakes, and sometimes, most importantly, they can finally bring some peace to grieving families.
Now get this number. Studies show that in about 25% of all autopsies, a major diagnostic error is found. Just let that sink in for a second. That means in 1 out of every 4 cases, a significant condition that was missed while the patient was alive is only discovered after they've passed away.
And that really points to a much bigger issue. With some estimates suggesting that 1/3 of all death certificates have incorrect information, the autopsy becomes this incredibly important quality check for the entire healthcare system. It's like the final audit that helps us learn from what went wrong so we can improve care for everyone who's still living.
Its purposes are just so broad. For the justice system, it's about solving crimes. For medical science, it's about confirming a diagnosis or even discovering a brand new disease. And for families, it can provide that invaluable gift of closure, of finally knowing what happened.
But here's the thing you have to remember. Not all autopsies are the same. It is not a one-size-fits-all kind of deal. The path you take really depends entirely on the specific question you're trying to answer.
So let's look at the 4 main paths to the truth. First, there's the forensic autopsy. That's the one you always see in crime shows, right? It's legally required when a death is suspicious or violent. Then you have the clinical autopsy, which a doctor or the family might request to better understand a disease. There's also the academic type, which is purely for teaching students in medical school. And now, we've even got the virtual autopsy, which uses technology like CT scans to get a look inside without ever making an incision.
Now, the 2 most common types, forensic and clinical, they really highlight this dual role. One is all about serving the justice system. It's mandated by law. The other is about serving medicine and science, and it's requested with the family's consent. So you've got 2 very different paths, but they're both heading toward the same exact goal: getting answers.
All right, so let's get into the actual process. Let's take a look at how this investigation is carried out, both methodically and, just as importantly, respectfully.
The whole procedure is broken down into 3 really distinct phases. It always starts with the external examination, then moves to a very detailed internal investigation, and it always concludes with the respectful reconstitution of the body. So, phase 1 is all about the external clues. Before any incision is even made, the pathologist is like a detective, documenting absolutely everything on the surface of the body. We're talking photographs, weight, any identifying marks like scars or tattoos. They're collecting trace evidence like fibers or residue, taking hair and nail samples. Every single detail is recorded because it's a potential clue. Next up is the internal examination. A Y-shaped incision is made, which gives access to the chest and the abdomen. The organs are then systematically removed, and each one is weighed, examined very closely, and small tissue samples are taken to be analyzed under a microscope. This is really what allows the pathologist to see firsthand what was happening inside the body. Once that detailed internal exam is complete, we move to the final, and you could argue, most crucial phase, the reconstitution. The organs are returned to the body, and all the incisions are carefully sutured. The whole point here is to ensure the body is treated with the utmost respect, so that if the family wishes to have an open casket viewing, that's absolutely possible.
So you might be thinking, hey, in a world of advanced MRIs and CT scans, is this whole procedure even relevant anymore? And the answer is a massive yes. And if you look at its history, you'll see why. I mean, this practice has incredibly deep roots. It goes all the way back to the ancient Egyptians examining organs during mummification. The first documented forensic autopsy, that was performed on Julius Caesar, and it famously found that out of his 23 stab wounds, only the second one was actually the fatal one. But it wasn't until the 19th century that a pathologist named Rudolf Virchow established the standardized scientific protocols that are still largely in use today.
And this power of discovery is just such a huge part of the legacy here. Major medical breakthroughs, like identifying Legionnaire's disease or really understanding fetal alcohol syndrome and viral hepatitis, all of those were pushed forward by autopsy findings. It's a foundational practice that has time and time again completely changed the course of public health.
And yet, despite all this proven value, something really surprising is happening. As you can see from this chart, autopsy rates in a lot of Western countries have been falling dramatically for decades. I mean, in the UK, it's now fewer than 1% of hospital deaths that are followed by an autopsy. That's a staggering drop.
And this decline, it raises a really serious question. Without this final check, are we losing a vital opportunity to catch medical errors? I mean, if mistakes that result in death aren't investigated, then the lessons that they could teach us just remain unlearned. And that has very real consequences for patient care down the line.
Which leaves us with this final, crucial question to think about. As technology gives us all these powerful non-invasive alternatives, what is the ultimate value of direct observation? What do we truly risk as a society, as a medical community, by choosing not to see for ourselves?